Hi, excited to welcome you back from Unified OSCE channel. Yeah, it's one of the nurses here. And thank you for the likes, comments, subscriptions. It means a lot. And in case you're yet to subscribe, don't forget to hit the subscription button. And if you want to get notified, please press on the notification bell. Yeah, thank you. For everyone that presents on this channel, we are all nurses practicing in the United Kingdom, and some of us are UN registered nurses, Australian registered nurses, but we just choose to be in the UK at this moment. Without wasting your time, today the focus is on removal of urinary catheter. Are you ready? Let's get started. Yeah, so we're starting with assuming all checks have been done. Now, sometimes in the OSCE station, especially for your skill station, the examiner says, assume all the pre-checks have been done. This is to save you time. And just all you need to do is to verbalize that. Go ahead with your hand hygiene. So assuming all checks have been done, this includes safety, identity, comfort, consent gain, privacy provided. I will go ahead to do my hand hygiene, put in an ampoule of gel. I rub palm to back of hand, vice versa, palm to palm, fingers interlaced, fingers interlocked, vice versa, rotational rubbing of the thumb, rotational rubbing of the thumb, fingertips on palm, vice versa, my ribs in rotational manner, my wrist in rotational manner, allow my hands to air dry for 30 seconds. So I'll go ahead to read my scenario. That gives me a clue of what I'm doing in the station. And after that, I'm going to get my materials. Getting my materials, I repeat my hand hygiene, but I don't have to verbalize it at this time. I put on my apron. Assessor, can I confirm my tray is clean with soap and water within 24 hours? Yes. Okay, perfect. Now, the tray is cleaned with soap and water, but I'll still go ahead to clean with a cleaner wipes. I've confirmed the cleaner wipes is in date, is not expired. I put my glove, both hands glove, gets the cleaner wipes, clean in S-shaped manner, the upper part, discard that, take another one, clean the back side in S-shaped manner. Whatever gloves I've used for cleaning the tray has to go in the clinical waste, and I'll repeat my hand hygiene. If I'm still going to continue with this apron, I need to verbalize that. Assessor, please, can I just continue with this apron, assuming it's not visibly soiled? Okay, thank you. So now I'm going to get my materials ready. For the materials, I don't need to put the glove. I need 10 ml syringe. The expiry date is May 2027. It's intact, in date, and happy to go with that. I need a sterile glove, a sterile gauze. It's in date, expiry date is January 2027. It has an E marking, and I'm happy it's not open. I just need a clean ink pad. I'm happy to take that along. On the box of the glove, it's just a clean glove. I've confirmed it's in date, so I'm going with 2 pairs of glove. I've got my Kleenex here. It's intact. It's in date. I'm happy it's not expired. The expiry date is 2027. And I've got my normal saline. It's clear, no any sediments, and the expiry date is 2027. I'm happy to use that. So I've gotten everything I need. I'll repeat my hand hygiene. And I'll be going back to my patient. So going back to my patient, the name of my patient is Janet James. I will just relay with the mindset that I've met this patient before. Assuming I've met and I've done all the safety, identity, privacy, comfort, everything, allergy check is done. So you don't have to repeat that. It's just to save you time. Hi, Janet. It's your nurse, Ademola. I'm back, like I said. Are you still happy for me to go carry on? Okay, thank you. Do you need a chaperone, Janet? Okay, wonderful. You're fine. So I'm putting on my gloves. All the pre-checks have been done, remembered, so I don't need it's assumed I've done privacy, I've done identity, comfort, everything. So I don't need to waste my time repeating that again. So I put an ankle pad just to make you comfortable. I'll be exposing you minimally. Hope you don't mind. Okay. I'll put my syringe using a banana shape method and a non-touch technique with the tip. I've confirmed from the documents that it was inflated, the balloon was inflated with 10 ml. So I will attach this, not making effort not to touch any of the parts, key part. Even without pulling it, it's coming on its own. So I've confirmed it's 10 ml. Assessor, can you just please confirm this is 10 ml? Okay, and this goes straight into the clinical waste, not on your tray. Yeah, Janet, can you take a deep breath for me as I use a gentle, firm, continuous traction to remove your catheter? Breathe in, breathe out, breathe in, breathe out, in, out, and that's it. So I've removed the catheter. I'm looking at the tips. There is no any form of encrustation. There's no pulse. So the tip of the catheter is fine. I'm fine with that. And everything goes into the clinical waste. I'll just use the Inco pad just to wrap everything in the clinical waste. I will repeat my hand hygiene, following all the steps. Are you okay, Janet? Okay. So I'm just going to put a new gloves, and that is why I have two pairs of gloves. I've done my hand hygiene. I'm putting on the second pair of gloves. This is my cleaner wipes. I open it for the saline, and this goes in the clinical waste. I clean for 30 seconds and allow to dry for 30 seconds. This goes in the clinical waste. I pat open my gauze. I pat it open and just put it on my tray. I need a dry part and a wet part. So I'm going to wet just a part of it, not everything. And this goes in the clinical waste. So the wet part, I take a gauze. I'm just cleaning you. Clean the vulva area, inward, outward. One stroke on the side. And this goes in the clinical waste. I take another one, inward, from top to bottom, a stroke, and that goes in the clinical waste. And I take the dry gauze and pat dry, and that's it. And important thing you must not miss out is the advice you need to give. Janet, so I will just let you know, you may experience some frequency, urgency, or some form of discomfort after removing your catheter. I will advise you not to worry about this. This is something expected after the removal of catheter. I will advise you to take 2.5 liters of water. Some mild exercise will be fine. And after making the first urine, I will need you to make it in a bedpan. So we need to see how the urine looks like, and we want to see how much of urine you're able to pass after removing your catheter, just to be sure you don't have any difficulty or any form of retention. Is that okay with you? Yes. And I'm going to document what I've done. And that will be all for now. My apron goes in the clinical waste. Janet, do you have any question, any concern for me before leaving you finally? No, okay. This is the call bell. If you need anything after I've gone, just press the bell and someone will be right here to attend to you. Yeah, thank you. I'll do my final hand hygiene and I'll make sure I document everything that I've done. And that is your removal of urinary catheter. Wishing you all the best.